Really, if you water.
What?
Well, usually I'm on that direction pretty much only when they start coming in.
Yeah, your neck. Heard anything from me? I'll join. No, that way it's just taking it too. Not this way. Yes, exactly. I mean, she works here. So, like, they have a weekend person, and they have a weekend staff. They're just very so, no, I don't even know. They all like my I would say, how I felt. I'll get all that done, and I'll see the resolution with all that information there. Take up a lot of space. But I'm also interested on the website. He actually said this when I was going to back to his house. That way I don't have to worry about Running around. Oh yeah, that'd be great. Yeah, I saw it come in and I just yes, I always see them. You need anything? No, I know it's not wrong. But please, I mean, did you just talk about rally? Okay, yeah, I do.
Welcome everyone to the 2017 May commencement ceremony of LSU Health Science Center in Shreveport. Would you all please stand for the national anthem? And please remain standing for the invocation, which will be given by the Bishop of the Catholic Diocese of Shreveport, Most Reverend Michael G. Duca, Bishop of the Catholic Diocese.
O divine physician, fill our gathering today with a spirit of celebration as we honor these graduates at the completion of their studies. We give you thanks for the blessings of this medical school who prepared these graduates who will serve us when we are in need of healing and care or in the research that will advance the care we receive. Fill our graduates with a respect for their patients, using all their skills for their benefit. Make these new doctors and therapists never cease to be filled with a desire to learn ever more about the wonder and awe of human life, and this all may engender a deep respect for the patients they will serve. For those in research, give them an enduring dedication, patience, and desire to work for the good of all mankind. Give these graduates humility to seek help when needed, and the courage and confidence required when they must act in difficult situations. Guide our proceedings today with a spirit of dignity, respect, and joy. We pray this in your name, who is love and the source of all life. Amen.
Please be seated. Now, it's my pleasure to introduce our Chancellor, Dr. Gali E. Gali.
Good morning. Welcome to this auspicious occasion. Thank you, Dr. Eckerstadt. I'm going to try to keep my comments as brief as possible because nobody wants anybody to talk too long, particularly on an occasion like this. Dear graduates, guests, faculty and staff, families, alumni, and friends, it is certainly my high honor to welcome you to the 2017 commencement of our LSU Health Sciences Schools of Medicine, Allied Health Professions, and Graduate Studies. On behalf of all the graduates, I want to thank those of you who traveled from far and near to join us here today. Not only do we appreciate your presence at this auspicious ceremony, but also your guidance and support over the careers of these students. Each of you has played an integral role in shaping the success of the 175 students who will receive their diplomas today. They could not have done it without you. I would also like to acknowledge those who could not be here, but who have provided inspiration and assistance to our graduates. And to the class of 2017, congratulations. There are very few days in your life that you will always remember, and today is certainly one of those days. You have worked very hard. You have worked very hard for many, many years to reach this milestone. You have grown professionally and personally during your time here. You have not only earned your degree, you have forged friendships that will last a lifetime. Members of the School of Medicine's class of 1977 have marched in with you today. This is their reunion weekend in which they are celebrating their graduation 40 years ago. I would like to ask them to stand now to be recognized as our alumni representatives present each with a commemorative medallion. Congratulations. This class of 41 students was the fifth to graduate from the Shreveport Medical School. The quality of these physicians and their dedication to this profession reflects well on our school and faculty. As these doctors have cared for their patients in the years since their graduation, they help to solidify the reputation of our school as an institution that trains outstanding physicians. Please join me again in thanking them for being with us. Like the members of the 1977 class, this class of 2017 has received outstanding training. Whether you're going on to residency training, postdoctoral work, or a career, this is an exciting time to use what you've learned these past few years. Our faculty members, many of whom sit with you today, have helped prepare you with the knowledge and experience you need. They have worked tirelessly to give you a sense of mastery and confidence to prepare you for success. We thank them for their ongoing commitment. Thank you, faculty members. And so, graduates, today you crossed the finish line, or maybe in some sense you crossed the start line. You have overcome many challenges and achieved your goals. Enjoy the ceremony in your sense of accomplishment. Also remember to personally thank those who helped you along the way. It is now my pleasure and honor to introduce our distinguished guests who are seated behind me on the dais. The Honorable Jim McCrary, Louisiana State Board of Supervisors. I'm going to ask y'all to stand. Dr. Seth Burney, Commencement Speaker, Professor of Medicine, Chief Division of Rheumatology is pretty close. Yeah. University of Arkansas School of Medicine, and one of our former faculty members, and he's just in Arkansas temporarily, we'll see. Dr. Jane Eggerstadt, Vice Chancellor of Academic Affairs and Vice Dean of the School of Medicine. Dr. Sandra Orrig, Dean, School of Graduate Studies and Associate Dean of Research for our School of Medicine. Dr. Joseph McCullough, Dean, School of Allied Health Professions. Dr. Dennis Wissing, Associate Dean for Academic Affairs, School of Allied Health Professions. Dr. Chris Kevel, Vice Chancellor for Research. Dr. David Lewis, Vice Chancellor for Clinical Affairs. Dr. Lester Wayne Johnson, Vice Chancellor for Academic Affairs, Monroe. Dr. David Deshay, Professor of Cellular Biology and Anatomy and Co-Chief Marshal. Probably the most popular human on the campus. Dr. Jay Marion, Associate Dean for Academic Affairs and Co-Chief Marshal. Dr. John Carmody, President of Shreveport Medical Society. Dr. Debbie Chandler, Assistant Dean for Diversity Affairs. Dr. F. Scott Kennedy, Assistant Dean for Student Admissions. Mr. Roy O. Martin, Member, Louisiana Board of Regents. Mr. Kevin Flood, President and CEO of our LSU Health Sciences Foundation. Dr. Deanna Mirandino, President of the General Faculty. Bishop Michael Duca, Bishop of the Catholic Diocese of Shreveport. And last but not least, Ms. Kim Carmen, Registrar of our LSU School of Medicine. Dr. Eggerstadt.
Now it's my pleasure to introduce the Senior Medical School Class President, Maria Pere, who will address the students and present our commencement speaker.
Hi. Class of 2017, family, friends, faculty, and staff. As Dr. Eggerstadt said, my name is Maria Pere, and I welcome you all to the commencement ceremony for the class of 2017 at LSU Shreveport. I'd like to begin first and foremost by thanking the plethora of people who have made this accomplishment possible for us. Everyone in this audience has played an immensely important role in helping us to achieve this incredible goal of becoming physicians. There has been plenty of sacrifice along the way, and there's plenty more to come. Without the devoted support of our families, spouses, partners, mentors, and friends, this would have been a very difficult journey, impossible even, so thank you. To the incredible faculty and staff at LSU. I thank you on behalf of the class of 2017. Without your open doors, advice and direction, and commitment to our medical education, we would certainly not be here today. So thank you. To my classmates, dear friends, and now medical colleagues, it has been a distinct privilege to serve as your class president these last 4 years. Time and time again, people have asked me what I think of my class. Over and over, I would tell them, my class is the most amazing group of individuals that I've ever been associated with. Or, my class is just the best, hands down, they're awesome. Both are absolutely true. You guys are some of the most intelligent and driven people I know. My favorite attribute, however, of this class is heart. Over the last 4 years, I have witnessed so much heart go into your relationships with each other, your relationships with your colleagues, and most importantly, your relationships with your patients. I have no doubt that every individual in this room will be a capable physician, but more importantly, I know you guys will treat your patients with compassion, kindness, and heart. The true armamentarium of an exceptional physician. That being said, there are many challenges ahead. Residency will no doubt be difficult. It will require long hours and little sleep, combined with high expectations. It is in these difficult times that heart and compassion will be placed on the back burner, and it is precisely when I challenge you to bring it to the forefront. As John C. Maxwell said, people do not care how much you know until they know how much you care. Thank you. And now it is my distinct pleasure to introduce you to our guest speaker, Dr. Seth Mark Burney, which he is one of our very own. He got his BA degree at Lehigh University in Pennsylvania, followed by his medical degree at Temple University, School of Medicine in Philadelphia, Pennsylvania. He followed that at the University of Alabama in Birmingham, where he completed his residency in internal medicine. He then went to NYU Medical Center in New York for a fellowship in rheumatology, and then returned to Alabama and Birmingham to complete a fellowship in rheumatology and clinical immunology, as well as a postdoctoral fellowship in developmental and clinical immunology. After completing this fellowship in 1995, Dr. Burney joined us here at LSU as an assistant professor and was well-liked by both students and faculty, and he quickly climbed the ranks. In 2014, Dr. Burney held the title of Professor of Medicine with tenure in the Department of Internal Medicine and was the chief of the Division of Rheumatology and Clinical Immunology. In his nearly 20 years at LSU, Dr. Burney held many academic and educational positions, including he was a member of the Medical School Admissions Committee, the Residency Selection Committee, the Medical Curriculum Committee. He was on the Institutional Review Board. He was course director of MSK and immunology for the medical students, and he also served as director for the junior and senior medical student internal medicine clerkship. This long list, along with many other academic and educational endeavors. During his time at LSU, he also won many awards, including in 2006, the most prestigious teaching award given at LSU, the Alan A. Copping Award for Excellence in Teaching Clinical Sciences. From 2004 to 2014, without missing a single year, he was elected to serve as a graduation marshal by the LSU School of Medicine graduating class for each of those respective years. Additionally, Dr. Burney serves on several editorial boards, has received numerous sizable grants, and has a long list of publications in a number of respectable journals. In 2014, Dr. Burney was appointed the chief of the Division of Rheumatology and Clinical Immunology at the University of Arkansas for Medical Sciences, where he currently serves as a professor of medicine with tenure. Ladies and gentlemen, please join me in welcoming Dr. Seth Mark Burney.
Just needed to check. I'm not used to using microphones. My voice tends to carry. First thing, I want to point out that I'm from Temple, and the Temple colors are crimson, yet I'm wearing orange, and the note says, hood colors differ from your order, but represent the best match available. So I guess I'm here representing the University of Tennessee. Go Vols! to the medical students, leaving you guys was one of the most difficult decisions I had to make, because I had spent a really good year teaching and interacting with you. It was very difficult to move. Having said that, it was the right thing for us, but I'm tremendously happy that I've been given this honor to come and talk with you at this time. And so thank you for selecting me. I'm pleased, honored, and very humbled that you chose me to speak to you at this defining moment in your lives and your families' lives. Graduating from LSU Health Sciences Center in Shreveport. When the medical student president, Dr. Prey, invited me, I wanted this talk to be inspirational and useful. But how could I craft it into an appropriate presentation as you're about to actually take responsibility for your patients' lives? So as a result, I'm going to give you my recipe for becoming my ideal healthcare provider, the one who I would involve in my family's and my patients' care. My wish for you is that each of you develops into that individual. The first step to developing into my ideal healthcare provider is to identify and gravitate to a role model who embodies the necessary traits. Whether you recognize it, you've already had many role models: family members, teachers, classmates, faculty, and even patients. But you'll need to continue to find additional role models throughout your subsequent training and ultimate careers. During my medical school, residency, fellowship, and since becoming faculty, I've had several role models who have taught me about the science and the art of medicine and about life in general, making me a more tolerant, mature, and understanding individual, and in turn, a better doctor. These have included, during medical school at Temple, Bennett Lorber and Sharon Kolosinski; during residency and my research fellowship at UAB, Bob Kreisberg and Prescott Atkinson; during my clinical fellowship at NYU, Michael Pillinger; as faculty here, Candace Mitchell-Walkley and Mark Platt; and as faculty at the University of Arkansas for Medical Sciences, James Marsh. However, my three main role models whom I have observed and from whom I've learned have been and continue to be my parents and my wife. Their empathy and approaches to life have been instructive in my continued growth as a person and healthcare provider. Several characteristics which frequently overlap with each other are critical to maturing into my ideal adult and becoming my ideal healthcare provider. These include dedication, compassion, professionalism, humility, passion, and intellectual curiosity. Initially, as I composed this presentation, I did not include honesty because I thought that was obvious. However, with the advent of alternative facts and false news, such as, "Believe me, I know," "Poverty is a state of mind," "The world is only 5,000 years old," "Death panels," "Birtherism," "Nobody dies because they don't have access to healthcare," and 3 to 5 million illegal aliens voted in the election, I recognized that I needed to comment on honesty. Without honesty, all subsequent endeavors are tainted. Honesty with patients, colleagues, and oneself is critical to appropriately mature as an adult and thus as a healthcare provider. So all of my comments are made upon a background of implicit honesty. The first and probably most important characteristic involved in becoming my ideal healthcare provider is dedication. Thus, that our primary goal is to optimize the patient's care and outcome. You must remember and at times it will be difficult, to treat your patients as if they're your family or how you want your parents, siblings, spouses, or children treated. Regardless of the patient's financial or insurance status, disease, personal beliefs, or self-destructive tendencies, they still deserve the same compassion, kindness, and excellent care that you will provide to everybody else. You must discard your ego and pretension in order to care for your patients. If this means that you humble yourself or use humor to relax your patient and gain their confidence and trust, which will improve your ability to provide optimal health care, it's worth it. Furthermore, you must remember to apologize to patients when you're wrong and acknowledge when you don't know something. We are not perfect and we make mistakes. I've had to unlearn some very bad habits and learn new techniques on how to improve patient communication and display empathy. The sooner you admit that to yourself and your patients, the better the rapport, the more your patient will trust you, and the more effectively you will provide health care. That was number one, dedication. Number two is compassion. Compassion is defined as sympathy and empathy towards another's distress and the desire to alleviate it. I want to present a patient who I recently saw in clinic. An 82-year-old woman was referred with left lateral thigh pain, which I diagnosed as bursitis. The treatment which would relieve her pain was a very simple injection. However, the thought of an injection terrified her. I explained that I understood how frightened she was and assured her that it would be relatively painless and something that I'd done many times. However, she was still afraid. To alleviate her anxiety and fear, I joked that I hate the sight of needles. So I usually perform the procedure with my eyes closed. After her initial shock, I explained to her that because I like her, I would keep my eyes open, which relaxed her, allowing me to successfully administer the injection. The third characteristic is professionalism. Professionalism is not an innate trait, but is learned from your role models and will hopefully continue to develop throughout your careers, allowing you to be the most effective providers possible. As a healthcare worker, your professionalism begins with the realization that you've been given the privilege of seeing patients in nothing but a hospital gown, asking them the most personal questions, getting to know them over time, and realizing that you will help them make decisions that will impact on their life like few others can. All of your role models exemplify professionalism by interacting with colleagues, maintaining their personal integrity, and most importantly, practicing their specialty of medicine with the patient as their number one priority. I mentioned integrity, which is a crucial component of professionalism. But what is integrity? The Merriam-Webster dictionary defines integrity as a firm adherence to a code of especially moral or artistic values. That means maintaining an uncompromising devotion to honesty, credibility, reliability, and sense of responsibility. Examples include acknowledging mistakes, admitting lack of knowledge, and attempting to appropriately complete tasks that are expected. Without integrity, it is difficult to remain an effective provider. The fourth characteristic is humility, recognition of our own limitations, and that we can learn a tremendous amount of medicine from individuals we perceive as less formally educated or of less status than we. That includes nurses, medical assistants, and other healthcare professionals. We need to learn what we are not capable of doing, what we do not know, and when to ask for help. When we don't or won't acknowledge our own medical or professional limitations, It is either because we're afraid that we will be ridiculed or disciplined, we will disappoint our attendings and mentors, or because we think too highly of our abilities out of ego preservation. Does that sound like someone that we hear about in the news frequently? Most of our supervisors would rather have you call them too many times than too few. You must also remember that as students, residents, or fellows, you are still in training. Medical knowledge is continually changing, so a career in medicine is a commitment to lifelong learning. The sooner that you realize that you're supposed to ask for help, the sooner you will avoid medical mistakes that harm your patients. This allows us to subscribe to and live by the old dictum attributed to the Greek physician Hippocrates: first, do no harm. The fifth characteristic to developing into my ideal healthcare professional is to develop passion for medicine. As I'm sure you've already learned, to be good at something, you must be passionate about it. You eat, drink, and sleep it. To be a superb provider, you must have that same passion about medicine. That will compel you to practice the highest level of medicine and not compromise your medical values. I've noticed, and I suspect most of my colleagues in the audience have noticed, that the attitude has seemingly changed amongst trainees, students, residents, fellows, with regard to their level of dedication. It almost seems as if being a doctor is only a job and a means to an end. Whether that end is money, prestige, romance, or some combination of them, being a doctor is not just a job. It is a career and an honor. Whatever permutation of medicine you choose, private practice, research, teaching, please maintain your passion and your dedication. Once that starts to wane, it is time to do something else. The sixth and final characteristic in my formula is intellectual curiosity. It is your responsibility to strive to know as much as you can and to become the best healthcare provider that you can. Never settle for mediocrity or the idea that you're good enough. I know that's easy to say, but not necessarily easy to do. To accomplish this, you need to continue to learn about your patients and their conditions. However, even more importantly, is to always question everything that doesn't make sense. Always ask why. To quote my wife, the famous medical philosopher and radiologist, patients usually make sense. What she means is that with the correct information, most patients' histories and physical exams make sense. If they don't, then either your information is wrong or you just don't have enough of the right information. Don't take any information at face value. If the patient's history, physical exam, or diagnostic test results don't correlate with the rest of the data, ask why. It's amazing how much information the three-letter word why can uncover. As toddlers, you infuriated and frustrated your parents with that three-letter word. It's one of the most important words in the English language because it forces one to think about mechanisms and how to understand how things work. In my experience, the ability to recognize when something doesn't make sense and have the tenacity to pursue it is what differentiates a mediocre provider from the type who I will entrust with my patients and my family. Now, I'm at the end of my presentation, but because I like to hear myself talk, I have a few closing comments. As newly graduated healthcare professionals about to embark into the next stage of career development, I want you to know what my goals are for you. Goals that will allow you to reap the unique rewards of a career in medicine. First, Identify at least one role model at each level of training after whom you can pattern yourselves. Second, as new graduates, you're in a very unique position. There will be many times when you'll be the patient's primary healthcare provider. Spend time with the patient. They are not just a diagnosis. By listening to and talking with them, you're providing a significant service. Companionship, compassion, and comfort when they need it the most, when they're sick, alone, and afraid. In turn, if you pay attention to them, they will teach you both the art and the science of medicine. And don't forget to treat your students the way you wanted to be treated. Third, treat all patients the same, whether they're worth 50 cents or $50 million. Treat them as if they're your own family, with the same amount of respect and compassion as you would want your parents, spouses, and children to receive. 4, always question everything and look for the inconsistencies in the patient information and then investigate them. Don't take anything at face value. If someone says something that you don't understand or contradicts something you've already learned, then ask why. Always ask why. 5th, treat all members of the healthcare team with respect, because they're all involved in caring for your patients. Don't be too proud, too stubborn, or egocentric to listen or to learn from them. The nurses, dietitians, therapists, medical assistants can teach you a tremendous amount of medicine that will enable you to improve the quality of your medical care. Remember, the nurses are as important, if not more important than you, in the outcome of your patients, because they're the ones who are actually caring for your patients. You'll make the decisions, but the nurses are the ones who implement them. 6th, you've heard the saying, it's better to be lucky than good. In medicine, I would say, and I guess I will, that it's better to be dedicated than genius. And I think most patients would agree. They would rather have a dedicated healthcare provider than one who knows everything but is indifferent. I frequently see doctors who graduated in the middle of their class, but were dedicated and persistent in their approach to the patient, provide care superior to the brilliant but passive doctor. In order to succeed, you must dedicate yourselves to finding answers and relieving pain and suffering. You should always be the patient's advocate. Please do not get ambivalent, because our patients need us, especially in this environment of healthcare change. Finally, while fostering patient trust and building rapport with members of the healthcare team, don't forget to care for yourself. Medicine is demanding. People die and stress abounds. Cultivate and utilize your mentors. Reach out to them and to other healthcare professionals and ask for help when you need it. Everybody needs help at times. Despite what you may think, it is not a sign of weakness, and they've all been there before you and want to help you. Also, support your fellow trainees, because you're a team. Lastly, you are the future of medicine. You're about to enter the most noble of professions. But remember one very last and very important thing. Regardless of whether you choose rheumatology, surgery, rheumatology or radiology, rheumatology or pediatrics, rheumatology OB, rheumatology primary care, or even just rheumatology, to be really good at what you do, you must enjoy it. I certainly do, and I hope you will also. Thank you.
Thank you, Dr. Barney, for those thoughtful words, and I'm sure the students will take them home and ponder. now my pleasure to present the LNA Copying Awards. Sorry, I just disappeared there for a minute. While these commencement exercises are all about honoring our graduates, we like to take a few moments during the ceremony to pay tribute to some of their teachers. The LNA Copying Endowed Chair, established by the Louisiana Board of Regents, provides funding to support the LNA Copying Excellence in Teaching Awards at both medical campuses. This award is the most prestigious award for teaching in the biomedical sciences, and it's given by the two health science centers and is presented each year to selected individuals who are, and I'm quoting from the board, who are gifted in imparting knowledge, skills, and a lifelong quest for discovery, and who inspire the young men and women in whose capable hands will rest the health and well-being of the people of Louisiana for years to come. Because we have many outstanding faculty at LSU Health Science Center in Shreveport, selection of a single basic science and a single clinical science recipient is indeed a challenging task. This year's nominees continue to reveal the excellent cross-section of our teachers. The final winners are chosen by their leaders and colleagues, most importantly, by their students. And I'm very proud to present these 2017 awards. Along with the recognition afforded this honor, each recipient receives a lovely engraved award and a generous check from the LNA Copying Endowed Chair funds. As I present this year's winners, I ask that they come to the stage to receive their award. This first award is for excellence in teaching in the basic sciences. Over the past 7 or 8 years in which I've been involved with organizing the selection process for this prestigious award, I've seen a variety of reasons for which faculty members are selected to receive it. In some cases, the recipient has been responsible for making a major innovative change in the overall curriculum. Sometimes it's an individual who teaches, and teaches very well, across multiple courses, and comes to be seen as a welcome and trusted constant by the students. In this case, the recipient concentrated their efforts in one course, and effectively made that course nothing less than a masterpiece, a sort of little jewel of a course. This recipient personally gives excellent, well-organized lectures, but in addition, expanded that excellence into the entire course, serving as its course director. As many of you know from experience, some of the courses we take in school, and I'm speaking not just about medical school, we take because we have to. They're a requirement to get us one step closer to our graduation goal, and we don't really have any actual feeling one way or the other about them. They're simply a hurdle or a necessity to get to the next step. And then there are some that we do have feelings about, sometimes the feelings of dread, like, oh no, I have to take PChem or advanced calculus or something like that, fill in the blank. And then there are a few that we anticipate eagerly, not because they'll be easy, but because we know we're truly going to learn, and learning will be a pleasure. From nominating letters for this recipient, it is easy to see that the students who took this course greatly appreciated it, but it is also clear from letters of those who had not yet taken the course that they were very much looking forward to it. What makes a course like that? In this case, it is a course director that truly approaches the course with this question: what is the very best way I can make sure these students understand, appreciate, and retain the information I have to give them? Words like engaged, diligent, organized, available, innovative, and constantly striving to make the course better, even when it is already good. These are the descriptive words for this recipient. Let me tell you how these qualities in this recipient have been described by nominators. One student wrote that this recipient has been the most involved and most approachable course director in my past 2 years as a medical student. Another wrote that this recipient is really invested in our success, and that makes me feel really good. This recipient continuously shows the students that they are the first priority. Related to that quality I said was diligence, another wrote that this recipient was the only course director I can recall that attended all of our lectures with us so as to have an idea of what was and what was not covered by the other lecturers. Regarding that concept of innovation, one wrote that this recipient piloted a few clicker response classes where students receive actual class credit for their responses and allow students to become more engaged in classroom learning. Then there were nomination letters from other faculty members, and one included a comment that I think is one of the highest compliments you can receive as an educator. My decision to nominate this recipient is based upon the fact that she taught me to be a better educator. And finally, while it is always satisfying to receive praise from students and even fellow faculty, it is even better to hear from graduates who, in looking back through all of their medical school career, identify your course or your efforts as valuable. One such comment from a graduate was, "I believe it is safe to say that I would not be the same person or the physician I am today had not this recipient been a key teaching component in my life." This nomination was strongly supported by the selection committee's medical student representatives and also heartily endorsed by the graduate students and faculty on the selection committee. The 2017 Alan A. Copping Excellence in Teaching Award for the LSU Health Science Centers in Shreveport for the Basic Sciences goes to R. Ellen Friday, Ph.D., Assistant Professor in the Department of Medicine. Our second award is for excellence in teaching in the clinical sciences. This year's recipient has served as a faculty member for a little over 5 years, and in that short time has made an indelible impression on virtually every level of learner in medicine at our Health Science Center, from students to residents to fellows, and also including faculty in her own and other departments. She's one of those teachers who is acutely aware of the level of her learners and can at one point provide a clear, understandable lecture for a first-year medical student level about basic disease processes or concepts, and then change gears and make an equally excellent presentation about advanced topics and therapy related to current diagnoses and treatment for residents and fellows. No matter if the learner is a beginner or about to enter specialty practice, evaluations show that this recipient's presentations are clear and thorough and effective. But in addition to excellence in didactic presentations, it's important for a clinical educator to be able to teach effectively at the patient's bedside or in the clinics. Evaluation comments from students and residents about her clinical teaching certainly confirm excellence in this area. Resident comments say, "She takes every opportunity to teach." One medical student commented, "She always encourages us to participate in patient care and team discussions and makes everyone, whether resident or student, feel comfortable in the medical team setting." But even further, it is not sufficient to simply be good at getting knowledge across to your learners in a clinical setting. Another critically important aspect of teaching at the patient's bedside is role modeling and mentoring, as you just heard Dr. Burney talk about. Picking your mentor, picking your role model, displaying the way that you should be an excellent physician. Again, this recipient is clearly a physician that students and residents recognize as excellent and want to emulate. One student wrote, "As a learner physician, I admired her attention to detail and thoroughness when it came to patient care. She was very good at leading the team in the right direction, stepping back when needed, and stepping in when needed, and stepping back when appropriate. Her greatest asset is her approachability and knowledge, both of which enhance the collaborative learning environment." Another said, "She has a wonderful bedside manner and develops a relationship with her patients that I hope one day to be able to recreate with my own patients." That's the part about mentoring and role modeling. Finally, nomination letters came not only from students and residents, but from fellow faculty members as well, who describe her as one who has a passion for teaching, is enthusiastic about giving as much of her time as needed to teach, and one of the most gifted clinical educators we have. High praise indeed. This nomination was unanimously supported by the selection committee's medical student representatives and the faculty on the selection committee. The 2017 LNA Copping Excellence in Teaching Award for the LSU Health Sciences Center in Shreveport for the Clinical Sciences goes to Sarwat Umar, MD, Assistant Professor of Medicine and Pediatrics, Section of Rheumatology. Glad these lecterns aren't too far apart. We now come to the conferring of degrees. Mr. Jim McCreary, member of the LSU Board of Supervisors, who will confer the degrees. At this time, I call upon Dr. Joseph McCulloch, Dean of the School of Allied Health Professions, to present the candidates for the degrees in Allied Health.
Will the candidates for the degrees from the School of Allied Health Professions please rise? Mr. McCrary, we have 52 candidates who have completed all the requirements for their respective degrees. I am pleased to add my recommendation to that of the faculty of the School of Allied Health Professions and present the candidates to you for the conferring of their degrees.
On the recommendation of the Dean and the faculty of the School of Allied Health Professions, and with the authority vested in me by the Board of Supervisors of the Louisiana State University System, I confer upon the candidates their respective degrees with all associated rights and responsibilities. Congratulations.
Graduates, please be seated. Mr. McCrary, you have conferred the degrees upon these graduates. I'm pleased to present them to you individually at this time to receive their diplomas. Dr. Dennis Wissing, Associate Dean for Academic Affairs, will read the graduates' names in alphabetical order by discipline. Graduates, please come forward as directed by the Allied Health Marshals, Dr. Johanna Bolt and Dr. Amanda Bernard, to receive your diplomas.
For the degree Bachelor's of Science in Cardiopulmonary Science, Jason Ray Adams. Caitlin Danielle Bibby. Lauren Salasi Birch. Lacey Danielle Ebar. Nicholas J. Jackson. Haley Camille Johnson. For the degree Bachelor's of Science in Medical Technology and Absentia, Jessica Lawless, Marissa Moffitt, and Hannah Ursery. For the degree Masters of Communication Disorders, Taylor Stegall Cavell. Amy Michelle Fontenot. Macy Amelia Lagan at Stimcha. Mary Kyle McDonald. Ashley Elizabeth Nelson. Rebecca Marie Peoples. Brittany Nicole Phipps. Morgan Ivy Randall. Taylor Ann Ratcliffe. For the degree Doctor of Physical Therapy, Dr. Justin Ellis Afford. Dr. Emily Rachel Bennett. Dr. Alexander Michael Bernard. Dr. Lauren Alexandra Bourgeois. Dr. Trent Matthew Brousseau. Dr. John Joseph Broussard. Dr. Jonathan Maxwell Campbell. Dr. Caleb Adams. I'm sorry. Got a very special call out. Dr. Hannah Wallace Gilbo. Dr. Nicholas Charles Gilbo. Dr. Chelsea Marie Carrion. Okay. Davidson. Dr. Laura Elizabeth Davison. Okay. Dr. Don Edward Honecker. Dr. Rachel Caitlin Howe. Dr. Joseph Paul Corey. Dr. Todd Daniel Lambert. Dr. Timothy Neil Lazarus. Dr. Stephen James Mayron, Jr. Dr. Lise Helen McDonough. Dr. Julie Martin McNutt. Dr. Cardaris Lamard Murphy. Dr. Brittany Lynn Oakes, in absentia. Dr. Maureen Ann Curran. Dr. Cody Jacob Richey. Dr. Hillary Marie Sawyer. Dr. Danielle June Teese. Dr. Hillary Francis Terrell. Dr. Victoria Lynn Upton. Dr. Jennifer Elizabeth Vey. Dr. Whitney Lynn Wiggins. Dr. Elizabeth Ann Wilhelm. Dr. Kelsey Delane Williams. Dr. Shelby Schmidt Willis. And Dr. William Ross Young.
I meant to mention it before, but the families and friends and loved ones of our School of Allied Health Profession graduates are doing it. So please, everybody, this is a one time in a life event. So please feel free to make whatever kind of joyful noise you wish to for your graduate. I now call upon Dr. Sandra Rohrig, Dean for the School of Graduate Studies, to present the candidates for the degrees Master of Science and Doctor of Philosophy. Dr. Rohrig.
Will the degree candidates please rise? Mr. McCreary, we have 9 candidates who have completed all the requirements for their degrees from the School of Graduate Studies. I am pleased to add my recommendation to that of the faculty of the School of Graduate Studies and to present the candidates to you for the conferring of their degrees.
Accepting the recommendation of the Dean and the faculty of the School of Graduate Studies, and in consideration of their high praise concerning the scholarly achievements of these candidates, with the authority vested in me by the Board of Supervisors of the Louisiana State University System, I confer the degrees upon these candidates. Congratulations.
Will the Ph.D. candidates please be seated, and the master's candidate please come forward. For the degree Master of Biomedical Science, Carrie Lynn Ford. His major professor was Dr. Steve Alexander from the Department of Physiology and Molecular Biology. Elliot Stewart Luttrell Williams in abstention. For the degree Doctor of Philosophy, will the major professors and graduates please come forward to lead the graduates? For the degree Doctor of Philosophy, Dr. Christine Elizabeth Birdwell from the Department of Microbiology and Immunology. Her major professor is Dr. Rona Scott, who is hurting her. And her dissertation title is Functional Consequences of Epstein-Barr Epigenetic Reprogramming of Epithelial Cells. Dr. Stephen Andrew DiGiuseppe from the Department of Microbiology and Immunology. His major professor is Dr. Martin Sapp, who is not here today, so he's being hooded by Dr. Rona Scott, who is on his committee. His dissertation title is Defining the Roles of Human Papillomavirus Capsid Proteins Following the Later Trafficking Events of the Entry Process. Dr. Casey Lynn Jackson in absentia from the Department of Pharmacology, Toxicology, and Neuroscience. Her major professor is Dr. Ronald Klein, and her dissertation title was Amyotrophic Lateral Sclerosis Modeling and Therapeutic Development. Dr. Courtney Michelle Keller from the Department of Pharmacology, Toxicology, and Neuroscience. Her major professor is Dr. Nicholas Getters, and her dissertation title is Investigating the Mechanisms of Action of the Combination of Metyrapone and Oxazepam, a Potential Treatment for Cocaine Substance Use Disorder. Dr. Ken Kanjunga Prasad from the Department of Molecular and Cellular Physiology. His major professor is Dr. Lynn Harrison, and his dissertation title is Mitochondrial DNA Double-Strand Breaks in Replication and in Repair. Dr. Xiaowei Shang from the Department of Biochemistry and Molecular Biology. Her major professor is Dr. Shilei Wang, and her dissertation title is The Mechanisms of Iron Chelation-Induced Inhibition of mTOR Complex 1. Dr. William Kiksasgi Sangak from the Department of Microbiology and Immunology. His major professor is Dr. Jason Bodley, and his dissertation title is Regulation of Transcription by Human Papillomavirus Type 16E7 Oncoprotein.
Thank you, Dr. Roerick. I'm now honored to call upon Dr. Gali E. Gali, Dean of the School of Medicine in Shreveport, to present the candidates for the degree Doctor of Medicine.
I'm going to expect to hear a lot more hooping and hollering here. That's what I'm talking about. Will the candidates for the degree Doctor of Medicine please rise? Mr. McCreary, the candidates have completed all the requirements for the degree Doctor of Medicine. I am pleased to add my recommendation to that of the faculty of the School of Medicine and to present these candidates to you for the conferring of the degree.
On the recommendation of the Dean and faculty of the School of Medicine in Shreveport, and with the authority vested in me by the Board of Supervisors of the Louisiana State University System, I confer upon each of you the degree Doctor of Medicine. This degree gives you certain distinctions and privileges. As you accept the degree, you must also be willing to assume the associated responsibilities that are involved. The university expects you to be diligent and steadfast in carrying out your obligation to render a high order of service to humanity. Congratulations.
Is that the best y'all can do? Doctors, please be seated. Faculty marshals, please take your places. It's quite an honor to be a faculty marshal, by the way. So thank you, guys. Will the first graduates please come forward? Mr. McCrary, you have conferred the degree Doctor of Medicine upon these graduates. I am pleased to present them to you individually at this time to receive their diplomas. Dr. Jane Eggerstadt, Vice Dean of the School of Medicine, will read their names.
Thank you, Dr. Ghali. Dr. Sam David Abdahu. Dr. Muhammad Hassan Akbarian Tafagi. Dr. Paul Louis Alvarez. Dr. Patrick David Albert. Dr. Avraham Amsalam. Dr. Spencer Darrell Armuth. I love that. Who will be taking up practice in Hawaii. Dr. Ashley Lafleur Arnaud. Dr. Amna Aziz. Dr. Morgan Moore Bankston. Dr. Travis Bruce Banta. Dr. William Harrison Bell IV. Dr. Gary Michael Bernard. Dr. Tucker Stephen Blackledge. Dr. Matthew Adam Blanchard. Dr. Daniel James Bonnet. Dr. Ian Michael Bulleney. Dr. Andrew Paul Bourgeois. Dr. Connor Carl Brown. Dr. Edward Kabibi Burkhart. Dr. Liza Barish Bird. Dr. Bird's diploma will be presented by her father, our former Chancellor, Dr. Robert Barish. Dr. Caitlin Elizabeth Carroll. Dr. Alicia Gabriel Chotan. Dr. Harry Chang. Dr. William Chang. Dr. Sean Edward Connor. Dr. Connor's diploma will be presented to him by his mother, pediatrics faculty member, Dr. Sheila Farrell. Dr. Jessica Lynn Cooper. Dr. Justin Blake Creel. Dr. Olivia Ann Daigle. Dr. Melissa Joan Davis. Dr. Kate Allison Digatere. Dr. Ginger Lynn DeGravel. Dr. Joseph Brantley Dressler. Dr. Caleb Anthony Dupree. Dr. Melissa Ann Eddie Shelby. Dr. Carrie Kersey Ellard. Dr. Mustafa El Sayed. Dr. Paul Andre Eugene. Dr. Andrew Ferraro. Dr. Lauren Carter Fisher. Dr. Cecilia Marie Fitzgerald. Dr. Fitzgerald's diploma will be presented to her by her mother, Psychiatry Department faculty member, Dr. Mary Jo Fitzgerald. Dr. Tori Louise Fourier. Dr. Blake Christopher Garrett. Dr. Tishelle K. Gatlin. Dr. John Jordan Gray. Dr. Catherine Wheat Greer. Dr. Chad Michael Gremion. Dr. Alan Gu. Dr. Christopher Joseph Haas. Dr. Brianna Lee Hall. Dr. James Reginald Hall IV. Dr. Enes Anwar Hamdi. Dr. Patrick Brian Harris. Dr. Jeffrey James Hebert III. Dr. David Edward Henderson. Dr. Latasha Juanetta Henderson. Dr. Lucas Tri Hong. Dr. Ethan John Hundley. Dr. Jacqueline Hebert Isabella. Dr. Benjamin Eccles Kilpatrick. Dr. Andrew William Kinchin. Dr. Seema Kumar. Dr. Carolina Patricia Larmieux. Dr. Kimberly Erin LeBlanc. Dr. Drew Michael Leday. Dr. Sydney Nicole Lee. Dr. Anna Yao Lee. Dr. Luke Joseph Leisherness. Dr. James Sidney Lopez. Dr. Francisca Therese Macheski. Dr. Lauren Elizabeth Mackey. Dr. Charles Lewis Madden. Dr. Alex Michael Maya. Dr. Holly Barr McCart. Dr. Molly Bates McCoy. Dr. Lisa Marie McDivitt. Dr. Amber Nicole Medine. Dr. Brittany Nicole Mitchell. Dr. Devin Blaine Moody. Dr. Howard Earl Morgan. Dr. Catherine Hope Morganti. Dr. Taylor Madeline Morse. Dr. Jonathan Brent Moss. Dr. Matthew Cade Moss. Dr. Michael Anthony Namor. Dr. Lindsay Marie Olind. Dr. Peyton Bannon Olson. Dr. Carrie Ray Oob. Dr. Nicholas Joel Palicio. Dr. Jonathan Edmund Pepper. Dr. Maria Mercedes Perez. Dr. Kara Macaulay Parmenter. Dr. Zachary Carl Pettis. Dr. John Michael Provenza. Dr. Shanterica Latrice Remo. Dr. Tamim Rizan. Dr. J. Michael Robichaud. Dr. Elise Bro Rogers. Dr. Nadia Gabriela Romero. Dr. David Michael Rudd. Dr. Brianna Narjus Sadat. Dr. John Earl Shaughnessy III. Dr. Emily Ann Songer. Dr. Elliot Jason Sorrell. Dr. Catherine Elise Stell. Dr. Shane Fancher Strong. Dr. Christine Elizabeth Taylor.
I'm gonna get one good one. Right there.
Dr. Lauren Hyatt Thompson. Dr. Monica Christine Torres. Dr. Christopher Jean Torres, Troxclair. Dr. Michael Henry Truax, Jr. Dr. Robert Hunter Vanderberg. Dr. Jonathan Paul Walter. Dr. Robert Daniel Zornbreaker III. Dr. William Daniel Zeichner, Jr.
What'd y'all think about all that? Well, you know, I saw some tears in the eyes of some of the moms and dads, so it means a lot to your folks and everyone that supported you, so congratulations. I will now administer the oath of Hippocrates to the medical graduates. Will the medical graduates please rise? You know, I said this before, white coat ceremonies and things like that, but you got to remember, this is probably one of the last times you'll ever be together as a complete class. So it's a very wonderful moment, it's a very solemn moment, and it's also a time to celebrate. So congratulations. Repeat after me. I do solemnly swear by that which I hold most sacred. I do solemnly swear by that which I hold most sacred. That I will be loyal to the profession of medicine and just and generous to its members. That I will be loyal to the profession of medicine and just and generous to its members. That I will lead my life and practice my art in uprightness and honor. That I will lead my life and practice my art in uprightness and honor. That into whatever house I will enter, it shall be for the good of the sick to the utmost of my power. Whatever house I will enter, it shall be for the good of the sick to the utmost of my power. That holding myself aloof from wrong, from corruption, from the tempting of others to vice. That holding myself aloof from wrong, from corruption, from the tempting of others to vice. I will exercise my art solely for the cure of my patient. I will exercise my art solely for the cure of my patient. And will give no drug, perform no operation for a criminal purpose, even if solicited, far less suggested. And will give no drug, perform no operation for a criminal purpose, even if solicited, far less suggested. That whatsoever I shall see or hear of the lives of men, which is not fitting to be spoken, I will keep inviolably secret. That whatsoever I shall see or hear of the lives of men, which is not fitting to be spoken, I will keep inviolably secret. These things I do promise. And in proportion as I am faithful to this, my oath, may happiness and good repute be ever mine. In the opposite, if I shall be forsworn. Congratulations, doctors. I'm happy to be the first to welcome our 175 new MDs, PhDs, researchers, and allied health professionals to the wonderful and evolving world of healthcare. Thank you for all coming today to join in the celebration, and a special thanks to our speaker, Dr. Seth Burney. Thank you, Seth, for being here. The Honorable Jim McCrary, Dr. John Carmody, Bishop Michael Duca, and Mr. Royal Martin. For a Chancellor and Dean, there is no better day than graduation day. This is why we have chosen this path, not only to care for the patients who need our help, but to be able to mentor and teach those who will one day take our places. Graduates, you have now become part of a very proud tradition that began with our first graduation 44 years ago, a special bond that is LSU. I am sure our guests from the class of 1977 would agree you have much to look forward to. I know that you will represent LSU with distinction. We hope to see all you back here in 40 years with your own stories of successful and fulfilling careers and lives. And believe me, that day will get here sooner than you think. Meanwhile, the best advice I can give you is to love what you do, exceed expectations, give back, and do your best. And of course, keep learning. Throughout your career, you will encounter many teachers, not the least of which will be the very patients you care for. Take advantage of the opportunities to be all you can be in every aspect of your life. In the words, as I've mentioned before, of our first Chancellor and my wise mentor, John McDonald, your reach should always exceed your grasp. God bless you, and God bless LSU.
Will everyone please rise for the benediction and remain standing until all the participants have exited the hall.
Let us pray. O God, send us forth with the joy of accomplishment and the excitement of new beginnings. Keep us safe in our travels home. Bring success to new endeavors. Inspire our graduates to never forget or take for granted the dedication of their teachers, the work of the many individuals that work to keep this school open, the support of family and friends, and the opportunity to receive this excellent education to pursue their chosen vocation. May they soon become an active part of the support for this important institution of learning so that it may endure for generations to come. Most of all, give us all here who have come today a thankful heart and joy for the essential vocation that these young people have chosen that will serve us in the future. We pray in the name of our God, the divine physician, the source of life, healer of body and soul, who lives forever and ever. Amen.
You can't go behind there.